She's always made herself available to me and us nurses. Like I've called her cell religiously when I've needed to. She's probably laughing because this happens in the middle of the night sometimes, and she answers all the time.
We had Inez as a student and a resident, and we could tell at that point she was a very compassionate, conscientious person that we really hoped at that time would stay in our community, because many people, students and residents, sometimes we have them and then they move along someplace else. But we've been so fortunate to have her stay in our community.
No matter what your status is, she treats everybody the same, with respect and professionalism. And she knows everybody by name, and I don't know how she does that. And that really goes a long way with the staff, with the family, and the patients.
She's somebody I would aspire to be. I mean, in nursing, yes, we all care, we do. Dr. Jinnah has just got this genuineness about her. She's an angel. I don't know, she's just like a mentor, like you aspire to be like that. She's very, very sincere. Even if she has a difficult caseload, a difficult atypical patient presentation, she doesn't let it frustrate her.
If anybody has had a family member unwell at home and has had the privilege of having Dr. Jinnah as their doctor, they know day or night, 24/7, she's available to go to the home. And that's something I think that inspires us to try and emulate that a little bit, to try and say, okay, if Inez can do this, man, we should be doing this too. And that's why with these awards, as she hates to have them called, I mean, she thinks as physicians, I mean, this is what we do. You know, this should not be, we should not be doing these things to try and get a trophy. But I mean, she pushes into us, we're doctors, and this is what we should be doing. We should be doing this to be recognized. I mean, this is what we do, and she pounds that into all of us.
Just phenomenal. I can't say enough about her. I don't think this video is going to capture everything that I want to say or anybody wants to say, but she always comes to the unit to assess her patients and her families, always.
When she first came to us as a doctor, when she was finished her student and residency, I remember Dr. Jinnah, and this is my favorite story, she would see patients, let's say on a Monday, and give patients prescriptions and whatnot. And then she was so worried about, number one, that she made a mistake, and so worried she didn't do the right thing, she would call every patient the next day to make sure, number one, they were still alive, and make sure that they were feeling better on the medication. She did this for a long time until she became a little more secure in her knowledge base. But I'll remember that till the day I die, her getting on the phone the next day, calling all her patients to make sure they're okay.
We're blessed not only as a hospital, as a community, from the staff, the patients, her colleagues. She's truly an amazing person and physician. She has this presence of making people feel calm and like everything's going to be all right, no matter what. I don't know. It's a good feeling.
Inez, I get a little emotional with this, but she's helped me through a lot of things, personal, and I love you. And the last thing I'd like to say to Inez is, you are my family doctor, and not once have you stuck your finger up my backside. I'm waiting for that day.